Hello and welcome to this short informational webinar about community programs available for the people you serve. My name is Natalie Gilbert and I will be telling you about physical activity and self-management programs the Utah Department of Health Arthritis Program supports. On this slide, you can see the mission and the vision statements for the Utah Department of Health. On this slide, you can see the 3 strategic priorities for the Utah Department of Health. They are healthiest people, optimize Medicaid, and a great organization. The Arthritis program is located within the Utah Department of Health and has existed since 1999. The vision of the Utah Department of Health Arthritis program is to increase self-management skills and improve the quality of life for all Utahns affected by arthritis and other chronic conditions. There is a workshop for everyone. The mission statement of the Arthritis program is, we provide technical assistance and coordination to increase awareness, expand reach, and achieve sustainability of evidence-based self-management programs for all Utahns affected by arthritis and other chronic conditions through statewide partnerships. First, we will talk about the 3 physical activity classes offered throughout the state. The physical activity classes we support are the Arthritis Foundation Exercise Program, EnhanceFitness, and Walk with Ease. The first physical activity class we will talk about is the Arthritis Foundation Exercise Program. This is a low-impact class that can be done either sitting or standing. These gentle, joint-safe exercises relieve stiffness and decrease arthritis pain. This class is 1 hour long and is 2 to 3 times per week. It is ideal for adults with arthritis or anyone wanting to establish an exercise routine. There is no cost, or there may be a small fee, and you can register at livingwells.utah.gov or call the number listed here on the slide. Participants who complete the Arthritis Foundation Exercise Program report they have improved functional ability, decreased depression, decreased pain, and increased confidence in their ability to exercise. Each class offers range of motion exercises and stretches, endurance exercises, strength building exercises, health education, relaxation techniques, and social interaction. This slide shows you a participant success story from an exercise training educator who teaches at the Arthritis Foundation Exercise Program. Wendy Moore says, it is an eye-opener to see how simple activities can change the abilities of people with arthritis. Participants who complete 8 weeks of classes are better able to do the things they want with less pain. The next physical activity class we will talk about is EnhanceFitness, otherwise known as EF. The EnhanceFitness class focuses on stretching, flexibility, balance, low-impact aerobics, and strength training exercises. The EF class is 1 hour long, and it is 2 to 3 times a week. EnhanceFitness is ideal for adults of all fitness levels who want to establish an exercise routine. There is either no cost or a small fee. And once again, you can register at livingwell.utah.gov or call the number here on the screen. Participants who complete the EnhanceFitness program report they have increased strength, greater activity levels, decreased depression, and improved social functioning. Each EnhanceFitness class offers a 5-minute warm-up, a 20-minute aerobic workout to lively music, a 5-minute cool-down, a 20-minute strength training workout, a 10-minute stretching workout, balance exercises throughout the class, and social interaction. Here you can see a participant success story from an anonymous participant who took EnhanceFitness at the Draper Senior Center. This participant said, "I was diagnosed with osteopenia about 15 years ago. I started taking a biophosphate, calcium, and vitamin D. I had bone density scans every 2 years, and even though I was faithful in taking my medication, I went into full osteoporosis. Now, after taking EnhanceFitness for 1 year and continuing on the medication and vitamins, last week my bone density scan showed a big improvement for the first time ever. Thank you." The last physical activity class we will talk about is called Walk with Ease. The Walk with Ease program helps participants develop a walking plan to meet their particular needs, helps them stay motivated, and teaches them how to exercise safely. The Walk with Ease program is also a 1-hour-long class and is 3 times a week. Walk with Ease is ideal for adults with arthritis pain or who just want to be active. There is either no cost or small fee, and details on how to register are listed here on the screen. Participants who complete the Walk with Ease program have experienced improved functional ability, decreased depression, decreased pain, and increased confidence in their ability to exercise. Each Walk with Ease class offers a pre-walk discussion covering exercise and arthritis, a warm-up and stretches, self-paced 10 to 40-minute walk, cool down and stretches, and social interaction. Walk with Ease can also be delivered in a self-directed format with a workbook and weekly interaction with a trained leader to guide the participant. This is a participant success story from a Walk with Ease participant. They said, "My children see a big difference in my attitude, and when I get home, I'm in a much better mood. I walked and got rid of the frustration. When I was working, it was not that way." In addition to the in-person program, there is also a Walk with Ease app that you can download on your Android or Apple device. Next, we will talk about our community self-management workshops. As you can see here, there are 7 self-management programs that are offered throughout the state. The first self-management class we will talk about is called Better Choices, Better Health. Better Choices, Better Health, or BCBH, is the online version of our Living Well with Chronic Conditions workshop. The class empowers participants to take an active role in managing their health by giving them the key skills they need to manage any chronic health condition. This class does not require real-time attendance, but is 2 hours a week for 6 weeks. This is ideal for adults with 1 or more chronic conditions, and there may be a cost, so please call for more information at the number listed on your screen. For Better Choices, Better Health, participants' self-reported measures 1 year after completing the workshop indicate reductions in health distress, pain, and disability, an increase in health behaviors including aerobic and strength exercises, self-efficacy and communication with physician, and reductions in healthcare use. Two trained peer facilitators moderate each workshop. Each week, participants are asked to log on at least 3 times for a total of about 2 hours. The Learning Center is self-directed in that participants can control the speed and timing of their progress. In addition, it includes the following: an interactive discussion center, tools area for journals, exercise logs, and more, a post office for communicating with other class members, a help area, and a book entitled Living a Healthy Life with Long-Term Chronic Conditions. The next self-management workshop we will talk about is called Living Well with a Disability. Living Well with a Disability is a 10-week peer-facilitated health promotion workshop for persons with disabilities or any physical limitation. This program is 2 hours a week for 10 weeks. It is ideal for adults with disabilities. There's no cost, or there may be a small fee. Participants who have completed a Living Well with a Disability workshop have reported improved outlook, positive changes in daily activities, achieving a personal goal, reduced limitation due to secondary health conditions, reduced healthcare costs, and increased awareness of disability rights and advocacy. The Living Well with a Disability workshop covers the following topics: goal setting, problem solving, healthy reactions to stress, beating the blues, healthy communication, seeking information, physical activity, eating well to live well, advocacy, and finally, maintenance of skills learned. The next self-management workshop we will talk about is called Living Well with Chronic Conditions. This is a program for people with chronic health problems. The program addresses common symptoms and worries from all types of chronic disease and illnesses. This class is 2.5 hours a week for 6 weeks. It is ideal for adults with 1 or more chronic conditions or their family members or caretakers. Participants who have completed a Living Well with Chronic Conditions workshop show increased exercise, increased ability to do social and household activities, less depression, fear, and frustration, reduction in symptoms like pain, increased confidence and ability to manage a condition, and decreased emergency department visits and hospitalizations. As you can see on the slide, the Living Well with Chronic Conditions workshop covers a lot of topics, including making an action plan to set and achieve goals, how to make healthy decisions, and working with a healthcare professional. This is a participant success story from a Living Well with Chronic Conditions workshop. In 2016, I had back surgery for a ruptured disc that left me with a permanent limp. Hiking and skiing have been a wonderful part of my life, so the change in my abilities was a major disappointment. After dealing with the medical issues, I was still dealing with depression. My doctor suggested both therapy and a support group. She gave me the information on this class, and it has been extremely helpful. The tools presented have given me the feeling that I can take control of my life, find joy in what I can do instead of focusing on what I can't do. Living Well with Chronic Pain is the next community self-management workshop we will talk about. The Living Well with Chronic Pain program is a 6-session evidence-based workshop designed for those dealing with chronic pain. This workshop is also 2.5 hours a week for 6 weeks, and it is ideal for adults experiencing chronic pain. Participants who have completed the Living Well with Chronic Pain workshop show increased exercise, increased ability to do social and household activities, less depression, fear, frustration, and worry about pain, a reduction in pain, increased confidence and ability to manage pain, and decreased emergency department visits and hospitalizations. As you can see, the Living Well with Chronic Pain workshop also covers a variety of topics, including pain and fatigue management, how to make an action plan, appropriate physical activity, and working with a healthcare professional. The following is a participant success story from the Living Well with Chronic Pain workshop. This class has been a lifesaver for me. I was so discouraged about being able to live a positive, healthy life with my injury and pain. The skills and insight and friendship and guidance from our instructors has given me a way forward and inspiration and examples to follow. The next self-management workshop we will talk about is called Living Well with Diabetes. The Living Well with Diabetes workshop is a 6-session evidence-based workshop designed for those living with diabetes. This workshop is also 2.5 hours a week for 6 weeks. It is ideal for adults with diabetes and their family members or caretakers. The Living Well with Diabetes workshop has participants who report having increased exercise, increased ability to do social and household activities, less depression, fear, frustration, and worry about their health, decreased emergency department visits and hospitalizations, and increased knowledge for dealing with diabetes-specific symptoms. Workshop topics during the Living Well with Diabetes workshops include monitoring blood sugar and managing hyper or hypoglycemia, how to deal with difficult emotions and complications, healthy eating, communication skills and working with your healthcare professional, and foot care. A participant success story from the Living Well with Diabetes class is here on your screen. This participant reported, "I began taking the class the first week in May 2018. Everything about this class has been so positive. The presenters are very knowledgeable, helpful, and supportive. I have learned so much about how to effectively manage my diabetes through healthy eating and portion size without giving up the foods I like. By practicing what I have been learning about eating, I have lost 20 pounds since I started taking the class. This class has reinforced the importance of a positive attitude, which I think is critical, and the need to follow through on the plans we decide to have to keep ourselves healthy and happy while living with diabetes." The next self-management workshop we'll talk about is called Programa de Manejo Personal de la Diabetes. This program is the Spanish version of the Living Well with Diabetes program we just discussed in the previous slides. The following slides will have the same information, but in Spanish. So, Programa de Manejo Personal de la Diabetes is also 6 weeks long with 2.5 hours a session. This class is targeted for adults with diabetes, family members, or caretakers of those with diabetes. And it is taught completely in Spanish. People who have participated in the Programa de Manejo Personal de la Diabetes workshop have shown increased exercise, reduction in symptoms like pain, increased confidence in their ability to manage their condition, and increased knowledge for dealing with diabetes-specific symptoms. The Programa de Manejo Personal de la Diabetes workshop covers a variety of topics, including pain, fatigue, and stress management, monitoring blood sugar and managing hyper and hypoglycemia, how to deal with difficult emotions and complications, and communication skills in working with your healthcare professional. A success story from this program in Spanish is here on your screen, and in English it says, "The classes helped me to understand why we should take care of ourselves and be healthier, and the importance of exercising and eating healthier." The last self-management program we will talk about is called Tomando de su Salud. Similarly to the diabetes programs, Tomando de su Salud is the Spanish version of our Living Well with Chronic Conditions class, which is taught completely in Spanish. Tomando de su Salud is also 2.5 hours and lasts for 6 weeks. This class is for adults with chronic conditions or their family members or caretakers. Participants who have participated in the Tomando de su Salud program have demonstrated an increase in exercise, less depression, fear, frustration about their health, more confidence in their ability to manage their condition, and a decrease in visits to the emergency department and to the hospital. The Tomando de su Salud program covers a variety of topics, including managing pain and fatigue, physical activity and exercise, and working with your healthcare professional. This participant success story from the Tomando de su Salud program is here in Spanish. It says, "It was interesting to me and I learned a lot about how to have a healthier life with more help and self-management tools for having a chronic condition. I am very thankful for the people who dedicated their time to teach us so much. Many thanks." Now that we are done discussing all of the self-management and physical activity programs that we support throughout the state, we will now demonstrate how to register someone for a class. The first step to register someone for a class online is to visit the livingwell.utah.gov website, which will bring up this page you see here on your screen. Next, click on Find a Workshop on the top left. Next, click the drop-down arrow to select the program you are looking for. Enter a zip code and distance radius if you want. Then click Search Programs on the right side of the screen, and a list of available classes will appear below. Once you have found the class you want to register someone for, simply click Register on the right side of the screen. Lastly, follow the prompts on the screen to register someone for a workshop. Workshop details such as location will also be available. Once registered, they will see a confirmation email from livingwell.utah.gov. Lastly, if you have any questions or would like more information, call the Health Resource Line using the phone number on your screen, or you can visit either the Arthritis Program website or the livingwell.utah.gov website to contact us.